Hello, my name is Dr. Diwan S. Raja. Today I will discuss about fracture of the scaphoid. The scaphoid is one of the 8 carpal bones, and the scaphoid is the most commonly fractured carpal bone. A fall on the palm with abducted hand causes scaphoid fracture. That means fall with the palm down, there is the stressed hand, and the person may get scaphoid fractured. A narrow part of the scaphoid, that is the waist, is the usual site of fracture, but it may happen at the proximal part of the scaphoid. It may happen at the distal part of the scaphoid. Pain occurs in the anatomical snuff box, especially during dorsiflexion and abduction of the hand. Anatomical snuff box is a space bounded by the abductor pollicis longus and extensor pollicis brevis anteriorly together, and the extensor pollicis longus posteriorly at the root of the thumb on the radial aspect of the wrist. Anatomical snuff box is more distinct when thumb is fully extended. So this is the scaphoid bone. This is the proximal part here. This part proximal. This is the distal part, and this is the common site of fracture. It may fracture here, it may fracture here, but that is the common site of fracture. Okay, and we are looking at the plain X-ray here. This is the fracture of the scaphoid bone here. We are seeing the lunate bone, okay, capitate, hamate, trapezium, trapezoid, okay, and we got the pisiform, okay, triquetral. So these are the carpal bone. These are the metacarpal bone. This is the lower end of the radius. This is the styloid process of the radius. This is the lower part of the ulna, the styloid process of the ulna. Okay, so we got the fracture here, but this fracture may not be distinct at the beginning of the patient finding. Idea is that first day, second day, third day, the fracture line may not be distinct. Fracture line may be distinct after 2 weeks. So we need repeat X-ray. One X-ray on the same day of fracture may not pick up the fracture line. Okay, we got that. Now we'll go to look at the scaphoid bone here. This is the scaphoid bone on the carpal bone here. Look at the blood supply. This is the radial artery, a branch of the brachial artery. So this is the radial artery, and this is the branch going to supply the scaphoid from distal part to the proximal part. So if there is a fracture here, this part may not get blood supply and it may go through avascular necrosis. So this is the distal part of the scaphoid bone. It may have fracture, but this is the most common site of fracture. This is the waist of the scaphoid bone. Okay, and this is the proximal fracture. It may be here, it may be proximal fracture here, and credit goes to Google Images, Andrews Sports Medicine. Okay, so we got the blood supply, pattern of blood supply from distal to the proximal part. So fracture here, we'll cut this blood supply to this part, and this part may go through avascular necrosis. Fracture of the scaphoid will go through that. Radiograph may be misleading. Repeat radiograph 10 to 14 days later is required to confirm the diagnosis. But we have the sign symptom. Patient has history of falling on outstretched hand, facing the palm down, as well as there will be pain in the anatomical snuff box. So we'll manage the patient as soon as possible. We'll put him the area immobilized and a cast, and the X-ray should be done repeatedly to find out the line of fracture. Due to poor blood supply to the proximal part of the scaphoid, there is possibility of avascular necrosis of the proximal scaphoid. It may be associated with lunate dislocation. Lunate is another carpal bone that may be dislocated. It may take about 3 months to heal a well-treated scaphoid fracture, but there may be chance of non-union. Okay, so if it is not managed from the very beginning in a proper way. Treatment, immobilization and analgesic, certainly consultation with a hand or orthopedic surgeon. Surgery may be required if there is malunion. Okay, we may get that. So that's all about the fracture of the scaphoid. So here our symptom is pain in the anatomical snuff box, especially during dorsiflexion and abduction of the hand. And we got the carpal bone, the radius ulna. This is the scaphoid bone. This is the line of fracture, but it may not distinct from the day one. It may take several days to get the distinct line of fracture, but patients should be managed from the very beginning, and preferably by an orthopedic surgeon, and very specifically, if possible, by a hand surgeon. Okay, so we got that. And this is my book, Upper Limb Anatomy Tutor. This is available in Amazon. If you are interested, you may pick up both paper copy and the electronic copy. Okay, and that's all about the fracture of the scaphoid bone. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.